Hi there, guys. This is chapter 2 of your pharmacy technician. This chapter is all about drugs and drug administration and things that go along with that. Food and drug administration, prescription drugs, generic drugs, over-the-counter drugs, route of administration, and common medications and substances. And again, I'll be showing you my book that has all the highlights and goodies in it, so y'all can follow along. First page. This is actually page 10. We've got to know what the FDA stands for, and you'll hear that a lot. It's the Food and Drug Administration. They are the ones who regulate what's going on with medications. And you need to know this definition. The FDA ensures that a drug is safe and effective, monitors drugs after they are marketed to ensure safety, and monitors drugs for possible adverse effects. So it's the regulating, even after people are actually taking it and it's been approved, they still do studies behind it. And you'll see a lot of those, they've been taken off the market or something afterwards, and that's who done it, the FDA. The FDA is responsible for the protection and promotion of public health by regulating and supervising certain products. So they regulate and supervise tobacco products, food products, medications, that's our category, prescriptions, over-the-counter, generic, and new, all medications, all vaccines, and supplements. Some supplements are not FDA approved, but if they are, those are, you know that they are what they say they are on the package. And they do regulate at the federal level concerning drug products. So federal level is your FDA, which stands for Food and Drug Administration. Okay. The FDA has several offices: the Center for Biologics, Devices, Food Safety and Nutrition, Tobacco Products, Veterinary Medicine, so they do that as well, Drug Evaluation and Research. There are also some more drug evaluation and research. They also run the Office of the Center Director, the compliance, new drugs, non-prescription, pharmaceutical, oncology, which is cancer drugs, medical policy, generics, testing, research, new drugs, and biotechnology. So they are very responsible for everything that goes on with our medications that we will be handing to our patients. We are talking about prescription drugs. Now, y'all underline what I have underlined. Those are things that you will see. Again, I promise. They are underlined and starred and all that for a reason. Certain medications are habit-forming. These prescription drugs, also known as controlled substances, can easily be abused and therefore regulated by federal law. So there are prescription drugs called controlled substances that are regulated by federal law, particularly because they can be abused. Prescription drugs are medications which are regulated by legislation. In order to obtain these medications, you must have a prescription. And y'all already know that. That's the thing they give you when you have to go fill your medications after you went to the doctor. The responsibility to show proof that a new drug is effective and safe lies with the manufacturer. So they're kind of putting a lot of information right here in these first paragraphs, and they do along with giving you hints toward what may be on your tests in these first paragraphs. So they kind of jumping around. So the responsibility to show proof that a new drug is effective and safe lies with the manufacturer. So anytime you see something like that, always switch it around, and they will ask the question something like, whose responsibility to show proof that a new drug is effective? And you will say the manufacturer. So that's how you would make yourself your own test questions out of this study guide. A prescription can be written by any licensed healthcare worker, such as dentists, veterans, nurse practitioners, medical practitioner, optometrists. All of those are able to write prescriptions. Roman numerals generally indicate the quantities for a prescription. So what do Roman numerals generally indicate? Quantities. In other words, how many medications, how many pills are you going to get? How many orders are you going to fill? But most of the time it is to do with the pills that you will be taking. For example, a prescription reading, caps, number, XIV, and you're going to have to learn those. I remember you should have a page in this book that we'll probably turn to in a minute that has all of your Roman numerals, and you need to learn them, especially these that they are showing and the ones that are very close to it. So XIV, y'all remember back in school days, anything with the I in front of it is a -1. And then the V is a 5. So X is always 10. Then you got the I in front of the V, which is going to be 5 minus 1. So you got 14 capsules. And a lot of times people just remember them, and the more you see it, the more you'll just gravitate toward it. You'll know exactly what it says. So X with the I in front of the V is 14. A prescription for tabs XL V111 is a prescription for how many capsules? So what you want to remember is that your V111 is, there's your V, which is 5, and then the ones are behind it, so that means 8. Then you've got your X and your L, which is going to be your 40. Okay? Other prescriptions may indicate the quantity in forms of drops. So you would need to know GTTS means drops. And if we got an M there, M is 1,000. So if we got drops M, that means 1,000 drops. So especially remember those. They will ask you very similar ones to that. Always know your Roman numerals because they will prescribe. Doctors still using Roman numerals to say how many capsules that they are to get. Any prescription drug has a package insert which contains information about the drug, such as its purpose, side effects, dosage, directions, and allergy warnings. So, what does a package insert contain? What information does a package insert contain? Information on the purpose, which is your effect, your intended effect, side effects, dosage, directions, and allergy warnings. The pharmacy technician must inform the pharmacist if a prescription warns of a potential interaction. A lot of times what you would do, you will enter the information into the computer system. The computer system will tell you that there is a potential interaction. Sometimes it is high interaction, low, but if it is an interaction, you need to get approval unless they have told you prior approval. If it's a low warning, then you can still give it or fill it. If it's a high warning, and you'll know that by the systems that they use, which one it is. And when you do start working, they will be able to tell you which ones you need to call the pharmacist on. And if there is a high interaction, you know not to give those two medications. You'll enter, say, Haldol and Ativan. Both of those are psychotropic drugs. Maybe there is an interaction, but they actually do give those together often. And it really depends on how the patient needs it. But you are the one putting that information into the computer, and if they are indication that they should not be taken together or they have interactions, you are the one to inform the pharmacist. You let them know, hey, there's an interaction. Should we give this medication or not? He says yes or no. Calls the doctor. Sometimes you'll have to call the doctor and let them know there's an interaction, high interaction for this, and can you order something else? And that may be possibly what you'll have to do as well. DEA numbers. Healthcare providers are assigned a DEA number, which allows them to write prescriptions. So everybody has a DEA number. And that's just a number, and it's got all kind of letters. We're not going to be thinking so hard about that, but each of those numbers stand for something. It actually is a 2-letter, 6-number, and 1 check digit. That's exactly what the number is. And they know it is a real number by that. And they can look up your doctor by that. All prescriptions will have that DEA number on there for the pharmacist to look up their DEA number. After a while, you begin to see certain prescriptions and you'll know who they're from and what doctor's office they're from. But each of those stand for something. The first stands for the type of registrant. Second stands for the registrant's last name. They're all followed by 7 digits. And the 7th digit is checksum of calculations. So they kind of just go through and make a number, and you know it's a valid number because it is not only being able to look up and it matches the prescription or the prescriber, but also because of all the numbers that go together. We're not going to delve into that. Just know that those numbers are important, and they have to have one. The National Drug Code, or the NDC number, it's an 11-digit code that is assigned to the medication. And it identifies the vendor, the product, trade package. And it actually says where it came from. Sometimes it'll even say what line it came from, like if they have different lines making that medication. So first is your labeler code, then the product segment, and how it is packaged. That's what those numbers stand for. Just know that each medication has a number as well. Your writer, your prescription writer, and it could be anybody, a doctor, optometrist, veterinarian, nurse practitioner, any of those will have a DEA number. They have to apply for that to be able to write a prescription. And your drugs all will have a NDC number, National Drug Code number. Okay. So here is your label and package insert. Labels or package inserts follow a specific format, therefore making it easier for a patient to understand. Those are the inserts that you see. Sometimes they're large, sometimes they're long. You'll see them, but those are what describes the medications. In the U.S., the FDA determines the requirements for labeling. So who determines the requirements for labeling of medications? The FDA. Controlled substances generally have higher label requirements. Controlled meaning they are potential for abuse. They have most of your opiates, most of your morphine and pain medications. They are all controlled substances. Labels with specific warnings about foods to avoid, medications to avoid, and warnings about potential side effects are also known as auxiliary labels. And if you've seen on a prescription bottle, they're stickers, pretty much, what you will put on that medication bottle, because when you looked it up or when it printed out the information, it tells you what medications to avoid. This may make you sleepy. I know you've seen all those little stickers that can go on there. Make sure you eat this with food. They really mean eat it with food, because it can tear a hole in your stomach. And a lot of people don't really get that. Not only could it upset your stomach, but it actually can eat your stomach lining if you don't eat it with food. Some medications require food to help it digest. So you need to know the difference and be able to explain to your patients as well. And most of the time you'll see it will print out its own information sheet, and learn to start reading those so you know what to tell your patient beforehand. But they will print out on most of your doctor's softwares. The sections of the labels, you've got clinical pharmacology. So it's going to tell you how the medicine works in the body, what affects the medicine, and how severe they are. They may contain information from clinical study results. So you've got your inserts, and then you've got your labels. Here we are more talking inserts and labels here. Your inserts will have more stuff in it. Indications. What is the indication? That is the use. What is it used for? It lists the uses for which the medicine has been FDA approved. A lot of times, All you have to do, or all a doctor does, is look up a certain disease and look up, it'll have some medications there to prescribe. Most doctors have their own that they prescribe every time, but sometimes they will have to look up medications to be able to prescribe them. Contraindications, that's list conditions in which the medicine shouldn't be used, like pregnancy. There's so many drugs that we do not take because we are pregnant, and that is where that would be in. If you have high blood pressure, don't take this medication. If you have low blood pressure, don't take this medication. And or take it while you're laying down, making sure that you're not endangering yourself. Warnings that list your possible side effects. Some drugs do have side effects. They may list 50 side effects, but you may not get none of them. But those that are listed, somebody has gotten because they took that medication. And that is what they are obliged and obligated to write that as a side effect if that person had that side effect. Precautions, it's information on how to use the medicine safely. It lists possible interactions such as do not operate machinery, and you will see that a lot. Do not drive a car. Do not operate heavy machinery. They'll say that a lot. Adverse reactions, it lists all the side effects that have been observed in studies, and then yes, they still do studies even if it has been approved, and it has to be approved for us to be giving it. But they still do studies to make sure and see what goes on with those medications to see how good they are. Abuse and dependence, that's information regarding the risk of dependency. Some medications we prescribe and give out, people will become dependent on. And when they stop taking it, their body will react. That's how opiate people get kind of suckered in, that they're always taking opiates because there is a terrible detox to an opiate drug. And even though you broke your hip, you fixed it, and you took your medication, your pain medication for a week, sometimes your body gets so used to that that it becomes dependent. Most of the time, when you're having surgeries and you just take it, it does not become dependent. You might feel a little woozy or a little stomach ache, but not so much of the dependency. When you have taken those medications for a long amount of time, then you become dependent. And you'll see that as well, that people, they will titrate them down from a certain medication. Titrating meaning that they will say they had 400 milligrams, now they got 300 for 2 weeks, 200 for 2 weeks, 100, and then one every other day, and then they stop the medication. And on some medications that people have been taking forever, that's how we have to titrate them down. Overdose, information on overdosing, recommended actions. So if you do an overdose accidentally, what can you do? Dosage and directions, all of them will tell you exactly how to take their medications. You have 2 milligrams 3 times a day. That's your dosage and your directions. Medication information, it lists physical information about the medication, such as its color, markings, so you can identify what medication should be in that bottle. On most bottles nowadays, you will see pink round, and we know that when we look inside that bottle, it should be a pink round pill. And that is what they're talking about there. Sometimes it will also have, do they need refrigerated? A lot of your antibiotics, especially children antibiotics, where they mix them up, they are needed to be refrigerated. Most of your, anything ending with saline needs to be refrigerated. Then you have your classification of your prescription drugs. Know that classification refers to a grouping of numerous medications that have a common property. So they group them, like if they are for high blood pressure, all those will be grouped together. If they are a diuretic, means that it's actually a water pill that helps with blood pressure, that will be in a group as well. The CSA, which is the Controlled Substance Act, is the federal U.S. drug policy that regulates the manufacturing, distribution, importation, use, and possession of certain substances. So the Controlled Substance Act is saying that you can have this medication or not. It is the U.S. drug policy that regulates the manufacturing, distribution, importation, use, and possession of certain substances. So those are the people that will come at you if you are doing things wrongly. The Poison Prevention Packaging Act regulates issues regarding safety caps. So we know that a lot of the medications will have a hard to open top on purpose because so many children have got into medications. So the Poison Prevention Packaging Act regulates issues regarding safety caps. C2 prescriptions, also known as Control 2 drugs, require prescription because of their high risk of dependency. Question there could be, what type of controlled drugs require prescription because of their high risk of dependency? Control 2 or C2. A prescription for C2 substances must contain the patient's name, address, DEA number, and DAW information. You just make sure you remember all your meanings for what that has. When you are reviewing a prescription, you make sure that all of that is included on your prescription. There are 5 main categories for controlled substances. These categories are also known as schedules. So most of the time, lay language will say schedules. Nurses say schedules. It's in Schedule 1, Schedule 2. Instead of earlier where they said Control 2 drugs, we'll call it Schedule 2 drugs. And that's just how we label them. These categories are also known as schedules. The FDA, which is the Food and Drug Administration, and the DEA, which is the Drug Enforcement Administration, are the 2 federal agencies that regulate what drugs are added to or removed from each of these schedules. So they say what type of drug falls into these schedules. Like Schedule 1, it is drugs and or substances with high potential for abuse and really no current accepted medical use. This is mostly drugs, just those drugs that everybody takes. They will put, and I say everybody takes the recreational drugs, those that do not have it. And right now they've got marijuana in there, and it's just in there, not so much because of what happens, but it's because it's no real medical use. But they are changing marijuana. We will probably see it in another schedule soon. But all of these drugs that are listed here have these same characteristics. They're high potential for abuse, no current accepted medical use, they lack of accepted safety for the use of the drug. Unless specifically authorized, it is prohibited to manufacture, dispense, distribute, or possess with intent to manufacture or distribute. That sounds like a charge, and that's exactly what it's going to be if you have these. You cannot and are permitted or prohibited, to create, dispense, distribute, or possess with intent to manufacture or distribute. So we cannot make it, we cannot manufacture it, we cannot distribute it, we cannot dispense it. And those drugs mostly are your opiates. A lot of people know the word opiates, but there's several different names. I'm not going to make you remember all of them. Pick you one that you can remember, but what I do want you to remember, Schedule 1 opiates and opiate derivatives. And mostly the one that you're going to remember is the one I have circled there, which is heroin. Or psychedelic substances. A lot of people know marijuana all day and peyote. That's the ones they say the Indians use. I'm Indian. I have not had to use that, or not had to. Haven't had the pleasure, I'm sure, of using that. But those are in Schedule 1. Your depressants as well as stimulants. So a lot of those you do not want to take. And for your stimulant, they use meth. It also can be a depressant. It's really what it's mixed with. But they're both meth. Meth. M-E-T-H is what I'm saying. Okay? Then you have your Schedule 2 drugs. A little better. Maybe there's some medical use. So, but the wordage you need to remember is those words here. They are high potential for abuse, and what's special as different from Schedule 1, it is restricted medical use. But they can also lead to severe psychological and physical dependence. And that's why they're on Schedule 2. And a lot of our medications that we know about are on Schedule 2. Those are opiates again. And then they list morphine. That's the one most people's going to remember. Opium, oxycodone, oxymorphone, morphine, or phone. Those are the ones that we remember most out of our Schedule 2. Stimulants such as amphetamines, cocaine, methamphetamine. Those are very well known. Depressants. Phenobarbital, most people know about that one. Secobarbital. But those barbitals are the ones that fall into that category of depressants. Cannabinoids and immediate precursors, just something that comes from that. But most of your Schedule 2, their restricted medical use can cause psychological, physical dependence. And they are high potential for abuse. So there's a lot of them fall in your Schedule 2. So Schedule 3, we're coming on down, getting a little easier drugs, and I don't mean easier, but less toxic to your body, more medical use as we go along. So Schedule 3, they are drugs and or substances with less potential for abuse than Schedule 1 and 2. They're also current accepted medical use. So these, you will see, they will be prescribed. They have different names that come along with it. But what you need to know that Schedule 3, less potential, current accepted medical use, and moderate physical dependence, or high psychological. So you're kind of in the middle. We're moderate physical, but still messing with your psych. High psychological dependence. So Schedule 3, those are your stimulants. Most people might get the benzathymine. Not as much known drugs in this category. Most people know Schedule 2, and then the next schedules. Steroids, of course, comes from in your Schedule 3. So steroids, less potential, accepted, but can cause physical dependence, moderate physical dependence. Of course, we know about hallucinogens. Those can cause high psychological dependence, and a lot of your narcotics. Narcotics are useful. People use them every day for pain. And that's where a lot of our abuse people come from, is that pain. And still, most of the time we're putting them on Schedule 3 because they do have a physical dependence, a lot of psychological dependence. And we do use them because they work, but less potential for abuse. So remember your 1, your 2, and now we went to 3, and we're getting less harmful as we go along. So Schedule 4. There's that IV. You see the I in front of the V? That V is the 5. And then when you have an I in front of it, it means to subtract 1. If it's behind it, you add it. But the V is the 5. Okay? So Schedule 4 drugs are drugs and or substances with less potential or lower potential for abuse than 3. They have a current accepted medical use, and they can lead to limited psychological or physical dependency. So at this point, if you quit taking this drug or medication, they're not going to be as harmful of you detoxing from those meds. And they still include some narcotics, some stimulants, and I'm not going to ask you to remember all of those, but if I call it out, try to remember those. Most people will know amphetamine. Amphetamine is one that a lot of people used to lose weight on. They've actually tried to move that one from it as well because it caused something to do with your heart. But lower potential for abuse, current accepted medical use, limited psychological and physical dependency. That's your Schedule 4s. Depressants are there as well. You will probably recognize diazepam. That is one that is ordered very often, better known as Valium. If you know and have done your drug cards, diazepam is Valium. Okay? Then we're coming down to our Schedule 5 drugs. Remember that V is a V. and is a 5. And they describe it as lower potential than Schedule 4, current medical use, limited psychological physical dependency. And those are your stimulants, and some opiates are there as well. So you've got to know your schedules and what they mean. 1 is bad, 5 is not so bad. But they're all part of controlled substances. So they will be locked up most of the time. They will be protected. They will be counted because they are on the schedules. Okay? Generic drugs, and a lot of people know about these because you may order Lyrica, or the doctor may order Lyrica. You're the one that's going to have to say, well, we don't have any Lyrica. We have pregabalin. And I barely even know how to say that, but I do know that when I see pregabalin, that is Lyrica. Sometimes you will not have that name brand. Sometimes that name brand is not covered on their insurance, so they have to try the generic first. Generic is the more of the chemical name for that medication, whereas Lyrica, in this case, will be what the manufacturer who first made it called it, Lyrica. So let's go here at the top of the page. Generic drugs are defined as drugs which are comparable to name brand drugs. Once patents for name and brand drugs expire, manufacturers are allowed to copy the drug and release it under a generic name. So I believe it is 4 to 7 years, I'm not sure, but they stay under that one brand name. And because they're doing studies on it, they're trying to track it. They're trying to make sure people are okay taking it. So they will keep it under that brand name. And whoever invented it gets to make all the money for that. After a certain amount of time, like I said, 4 to 7 years, they actually release it and say everybody can make it. And so that's where the generic comes in. Generic drugs are generally less expensive than your name brands. And doctors will prescribe generic a lot of the times because insurance companies are going to want you to try the generic first before the name brand. Federal laws regulate that generic drugs must contain the same active ingredients as the name brand, making them identical in strength, administration, safety, dosage, and use. All that they're saying when it becomes generic is that somebody else is making it other than the people who pretty much invented it. That's all a generic is. Prescriptions issued for generic drugs are more common or more likely to specify the chemical name instead of the manufacturer. So you will see that is the chemical name. Omeprazole, that's your chemical name for Prilosec. So in the beginning, Prilosec was the name that the people who invented it made it. And then after your 4 to 7 years, they open it up, and it always has been omeprazole as the chemical name, but everybody else can make it under the name omeprazole. They can't make it up under Prilosec because that's taken, that's done. Whoever invented it gets to keep that. They can order it or make it under omeprazole, and that's the one over there, the second one in that right column. Also know what allergies are. Allergies are abnormal reactions to substances that are harmless to most people. You may have an allergy to a drug where everybody takes it every day. 99 people take it every day, no problems. You may have an allergy to it. That's why a lot of times I want my patients to take medications in front of me. I'll sit there with them 30 to 45 minutes to make sure that nothing's going to happen, that they're not allergic to it. Because people do and can cause terrible allergies. Or allergic reactions. Some will give somebody a seizure. Some will break them out in hives from head to toe. That can be very dangerous as well because it can mess with their throat and tongue swells so they can't breathe. So we always have to watch out for that. Know them drugs, and if they're on those top 100 drugs, make sure you know them fluently. Adverse effect. What is an adverse effect? It refers to an unintended side effect of drugs that are injurious to the health of patients. So that's just a fancy way to say you're allergic, but it is also known as an adverse effect. But it's not an intended side effect. something that we didn't know was going to happen. Recall of medications. Sometimes it will have to recall medications. I forget, just talking about Prilosec, it was one in that family that has been recalled lately. But recall means it refers to the removal of a drug from the market. It means actually they recall it, just like a car. They recall a car. They really don't recall the whole car. They just recalling the part they got that was messed up, and remove it and fix it. And in this case, most of your recall of your medications, they're not going to fix it. They found out something terrible or something bad, and they will recall it. Recalls normally occur due to discovered safety issues with medications. So when they find out it was causing cancer, they will take it off the market. And I believe that's something to do with what was happening to, I don't want to say Prilosec, so nobody will take Prilosec ever again. But it was a side effect, and people noticed it, and that it was a certain drug group, and they recalled that medication. We have over-the-counter drugs, and these are the ones y'all are going to be most familiar with. You can have prescriptions for this as well. A lot of doctors don't write prescriptions for it. They'll just tell you to pick up some. But insurances will cover over-the-counter drugs, so I want a prescription. Go ahead and write me a prescription. I know you said I could take it, but I need a prescription so that my insurance will pay some of it. Over-the-counter medications are also known as OTC, over-the-counter drugs. These drugs require no prescription and are sold directly to customers. The pharmacy buys these drugs from the manufacturers and sells them to the public. The difference in price between the pharmacy paid for the medication and the customer paid is the markup. And you will be in that segment knowing what the markup is for your medications, because you'll also be pricing them. You'll also be charging them. You know, some medications are $1 a pill. Imagine they got 30 pills, and so that's $30. And a lot of times you'll be involved in that. Most of the time it's your the owner or whoever that is that's determining that markup. But do know that definition. The difference in price between what the pharmacy paid for and what the customer pays is called markup. Although unnecessary, physicians may write prescriptions for over-the-counter drugs. So on that over-the-counter label, you need to see this: the manufacturer who made it, the product name, of course, the active ingredients. So when it's over-the-counter, they still have active ingredients, and this is what makes it work. And that's why they call it active ingredients. Amount in each dosage unit, maybe 1 pill, 2 pills, but they will tell you, say it's ibuprofen. Most ibuprofens are 200 milligrams, but your dose should be 800 milligrams. So you're going to take 4 of the 200s, and they will label that these are 200, so you know to take 4 of them. The intended use will be there. Say it's used Pepto-Bismol. Intended use is for sore throat, stomach, and diarrhea. So that is the intended use. It's also used for heartburn. All of that's intended use. It will also have your warnings and your side effects on there. Dosage instructions. You will take 2 pills every 4 hours. That is always on there as well. And your inactive ingredients are there. Common over-the-counter drugs, and y'all know these most well. Allergy, your Benadryl, Sudafed, Claritin, antihistamines, Actifed, Chlortramaton, NyQuil, Triaminic. Those all will help with that as well. Antihistamine is more itching or weird swelling. Antidiarrheal, that means it helps with diarrhea and laxative. That, of course, that's that Pepto-Bismol Kaopectate. A lot of people don't know about Kaopectate, but it is an anti-diarrhea as well. Cold sore, fever blisters, Abreva, Carmex. Cough suppressants such as Robitussin, Vicks, Chloraseptic. Decongestants, that's your Afrin, Alka-Seltzer, Drixorol. Diaper rash, most of us know if you got a child about Desitin. Eye drops, you've got Visine, that's the most widely known. First aid, you got Band-Aids, thermometers, and Neosporin. This is what they're labeling it like that or noting it like that because the pharmacy can order those as well. Anything dealing with your menstrual cycle, internal analgesic, we should know that it means pain or something that is going to help with pain. So internal analgesic is your Advil, Aleve, Excedrin, Tylenol, Bayer, and all of these are still over the counter. Menstrual cycle meds, migraine meds, smoking cessation, that's also meds. Tooth pain relief, we know Oragel, and wart removals. They say Tenamed, and I always just have seen where it says actual wart removal. That is your over-the-counter drugs. Now we will move to route of drug administration. So on the prescription, the doctor's going to write, how are we going to give this? You need to also know the routes of administration. So you know, is it going to get onto my skin, in my skin, a little under my skin, nasal passages, intramuscular, intravenous, sublingual are probably the ones you will most see most of the time, because that is most medications are delivered in that way. The route of administration refers to the way or path by which drugs enter the body. The path by which a drug is administered results in different effects. Some routes are chosen to achieve a systemic effect, and you need to know what this means. Systemic means non-local, such as the digestive tract. In other words, you want it to affect the whole body. So it's going to go through the digestive tract so it can soak up and go where it needs to go within the body. Or it might have a local effect, which is anything intradermal on top of your skin. Those kind of things are your local effects. Systemic means it's your whole body. Local means in a certain place. There's still other routes are chosen to reach different parts. And really depends on what the doctor orders. Most of the time it's a pill that you're going to go by mouth. That is your most common medication, especially that you'll be dealing with. IVs, you'll see that in the hospital. You may have to mix those. And that's something they'll have to show you. We don't actually do that. They will be able to show you that. Epicutaneous means onto the skin, maybe subcutaneous. That's the main one I want you to remember. If you don't remember anything, subcutaneous means under the skin, such as insulin. Insulin goes right up under the skin, right beside your belly button, about 2 inches away. That is sub-Q. Intradermal, such as PPD, if anybody's got their tuberculin skin test, that was an intradermal medication. It's right up under your skin, causes a little bump, and it actually goes away, and we can tell if it messes up or gets hard or starts getting red on you, that you may have been exposed to TB. Not that you have it, but being exposed. Nasal, of course, that's nasal cavities, inhalers. A lot of people with asthma, that's how they deliver it to the lungs quicker. Intramuscular means into your muscles. Intravenous, into your veins. Sublingual, another important one, means under the tongue. You know, you talk, and a lot of people know that linguists are people who talk well or study about language, but linguist, sublingual, means under your tongue. And then they will ask you, what is the fastest route of administration? And I put that right there just as plain. So, fastest method of administration, which is right up under inhalation. So what is the fastest route of administration? Inhalation. That means breathing in. The drug takes up to 10 seconds to reach the brain pathway. And the pathway is the mouth, trachea, bronchioles, alveoli. Then it goes to your body. So you just breathe it in, and it's the fastest way. Injections work very fast as well, between 15 to 30 seconds. So an injection takes effect 15 to 30 seconds. Tablets and capsules, probably your longest or takes longer to digest. And so takes longer to get through your system. You do need to know they are different types of tablets and capsules. You have your hard shell, soft shell. You have the capsules. You have the ones that have something in them, looks like oil. You have those that have little beads in there. Some have powders in there. Depends on what the drug is approved for. Know this as well, and you'll see this at times, not so much. It's more like a trivia question that you need to know. Capsule sizes range from 000 to size 5. That's just where it is. It's, 0 to 5. Size 0 holds the most volume, where size 5 holds the least. So we wouldn't know 0 is a bigger tablet or capsule or whatever. And then it goes to 5, which holds the least. So know your numbers. Know that it goes backwards. You would think if it was a 5, it'd hold more, but no. This one's backwards. If it's 0, it holds more. 5, all the way up to 5. Tablets, also called pills, are substances that are compressed into solid forms. You've seen, or I don't know, maybe you've opened up, like me, being curious, seeing what's in a Tylenol. Those are powders. And this substance, when you make a pill, it is just compressed powder. Size of tablets range from a few milliliters to 1 centimeter. They don't make them giant, but some people still have problems swallowing. And y'all will have to check that out too. And maybe some people, you'll have to cut their pills in half if they request it. Or you'll have to tell them to cut it in half, especially if they are hard to swallow. Some tablets are shaped like capsules, some are caplets, are caplets. So when it is still in a solid form, but not the shape of a pill, they may call it a caplet, which is just a pill shaped differently. All right, you need to know these medications, or maybe not so much medications, but categories. These categories do not go away. You need to know what an analgesic is. Relieves pain. And that analgesics go from Schedule 1 all the way to 5. So they fall within there. Then you got your antacids. No, it's for heartburn, indigestion. Because somebody's going to ask you, what is this for? And you want a plain little answer just like this is here. So you need to know these. Anti-anxiety is, of course, for anxiety. It helps relax muscles. Antiarrhythmics, what keeps rhythm? That's your heart. So it is control irregularities of the heartbeat. Antibacterials, infection. Antibiotics, used to destroy microorganisms such as bacteria, to treat infections again. Anticoagulants, helps prevent blood from clotting. It's a blood thinner. An anticoagulant is a blood thinner. And you can write that beside that as well. Anticonvulsants, if you're having convulsions, it means you are having a seizure. So that's what that means. Prevent epileptic seizures. Antidepressants, of course, it's for your mood. Antidiarrheals, to relieve diarrhea. Antiemetics. A lot of people do not know that emetics, that is actually, my CNA will, because we know that it is an emesis basin they give you to throw up in. Or to, throw up. That's the best word for me. But an antiemetic. I might have said that backwards. Oh, goodness. Antidiarrhea is to relieve diarrhea. Antidepressant relieves your mood. Antiemetics. Okay, I did. It's to treat fungal infections. I don't know where I went. But antidiarrheals, of course, is diarrhea. Anything anti, that is trying to stop diarrhea. Antiemetic, I feel like I said this backwards, but it is for fungal infections. I've got it right now. But disregard if I said something different. I feel like I did. Antihistamine is to treat allergies. Histamine is a reaction when you're allergic to something. So antihistamine calms that down, stops you from itching, does things like that. Antihypertensive, when you have high blood pressure, you are hypertensive, so that stops you from having high blood pressure. Anti-inflammatory, keeps you from swelling. Anti-etinoplastics, that is for cancer. Know that word. You'll see that word often. Antipsychotic is for psychotic or psychiatric disorders. Antipyretic, and I ever and always remembered when people like to catch fire or start fires, they call them a pyro. So that's how I always remembered antipyretic. It reduces fever. So when you're hot, we take an antipyretic, which reduces your fever. Antiviral, of course, is to treat viral infections. Just label all these. We're still going with what types of medications you will be ordering or filling. Barbiturates for sleep, beta blockers, oxygen. It reduces the oxygen needs of the heart. Underline that. They like to ask questions about beta blockers and what they specifically do. So a beta blocker, it's also for hypertension, but it reduces oxygen needs of the heart. Then you have bronchodilators. They actually dilate your bronchioles so you can breathe better. Cold remedies, anything for aches, fever, runny nose. We have lots of those. Corticosteroids. A lot of times you take a corticosteroid if you have those type diseases that make you swole from your own immune system messing up. And that's what happens in arthritis. Asthma as well. They take corticosteroids because you have inflamed something. So corticosteroid will actually decrease swelling, and that's what you need. Cough suppressants, that's what they do. Cytotoxics, it's used to kill or damage cells, and a lot of times you'll get those when someone has had a liver transplant, kidney transplant, or something like that, but you will get those cytotoxics. Decongestant, that's what it does. It reduces swelling of the mucous membrane. Diuretics, that increases the amount of urine from your kidneys. Water pill, that's the other famous name for a diuretic. We have several of those, Lasix being our most popular, and you should know that. Expectorants, that's what they do. They my words, they stimulate the flow of saliva, but they expect it out of you. It comes out, exits, expectorant. I put those together to know that that's going to stimulate the flow of saliva. Makes you cough and makes you expectorate that. Makes you cough it up. That's what an expectorant is. Hormones. They're produced by your endocrine glands. They assist in regulating bodily functions. So what assists in regulating bodily functions? Bodily functions are your hormones. Hypoglycemics, used to lower blood glucose levels. So hypo meaning low, glycemic, anything with glycemia in it means blood sugar. Immunosuppressants, talked a little bit about that with corticosteroids. They're very similar. They actually are used to prevent and reduce the body's reaction to invasion. In other words, your body is reacting some kind of way wrong to anything, and it will cause problems in your body because your body thinks it should kill something that it's not, shouldn't be killing because it's part of you. So that's why they take medications for that, so it won't kill itself. Laxatives, that's what they do. Muscle relaxants, release muscle spasms. Vitamins for your overall health. There are different kinds of drugs that they may do in studies. We're moving to the next page, which is 21. And they have such a thing called the placebo. The placebo refers to an inactive substance that is given to patients in place of a medication. You ask why in the world would they do that, but when they're doing studies, they need to have a placebo to make the experiment correct. So if you have a disease, they may give you a placebo where the next patient gets the real medication. But they are watching, and you have to sign a lot of paperwork saying you will participate. Placebo is going to say, okay, both of these had the disease. How long did it take this one that didn't have medication to recover while the next one that did have the medications, how long to take them, but it's all about studies. So again, placebo refers to an inactive substance that is given to patients in place of a medication. Patients sometimes have either a perceived or an actual improvement of their medical condition. The phenomenon is known as the placebo effect. So not only is it not medication, but some people, something about your belief in a medication that is working that you just took makes you feel better. And that's what they call the placebo effect. Depending on the use of measured deception, medical research often uses placebos as a controlled treatment. And I'm about tongue-tied saying that, but that's what they're trying to say, that you have to have a group of people that's really not taking the medication and to study it correctly. Common placebos are your inert tablets, sham surgery. I don't know a lot about that, but just know that. General procedure involving placebos. A lot of times, this is what people will be given, or they're trying to treat ADHD, asthma, bipolar, epilepsy, headache, migraine. And this is what they're trying to say. If you just give somebody some medication, whether it's medication or not, that these people have improved, even though they didn't get the medication. And that's what they continue to do studies on that. So one group will always have the placebo, one will always have med. The miscible, they are time-release medications. Kind of miscellaneous, but it's time-released. You'll see a lot of that as well. The term miscible refers to the ability of being mixed and remaining mixed. A lot of times they are to be mixed for a certain time release of the medication itself. Not that they didn't take the whole medication, but how fast is it going to give out? How much are we going to, like the pill dissolves at a certain amount of time. So that's 25%. And then when it gets halfway, we know it's 50%. But does it remain mixed? And that's just what we need to know, that definition. The ability of being mixed and remaining mixed. Whereas maybe if you mix sand, I'm going extreme, sand and water, if you keep mixing it, the sand is all in the water. But when you stop mixing it, it kind of falls to the bottom of the glass. That would not be miscible. And I also put mixable. That's what it is. I was trying to think of my word, but mixable. Instead of miscible, I don't know where they get the word from. It's probably Greek or Latin or something, but miscible needs to remain mixed. Mixable is the ones I use. Medications have a time-release technology, which enables drugs such as tablets or capsules to dissolve slowly and release the medication over a period of time. Just know that as well. And that's why some are in caplets and not in liquid form. In caplets or in tablets, it takes a minute to break down. So that's what they want. They want it like that. There are some capsules that take a lot longer to break down as well, because they want it to be time released. Time released tablets or and capsules have the advantage that they can be taken less often in comparison to instant release, which is good. But sometimes you want the instant release. You don't want it to wait a little bit. We just want the whole everything right now. And those do not let you get it all at one time. Studies have shown that time-release medications keep a more steady level of medication in their patients' bloodstreams. So what do studies show? That time-release medications keep a more steady level of medication in patients' bloodstreams. In their bloodstreams. That's what they're trying to say. And that is the end of that.